Host Alan Porter. Alan, what's going on, man? How are you?
It's going good here in North Carolina. Beautiful day.
It's not beautiful where I'm at, but we'll let it go because it's a great month, great day to be alive and do what we love. Alan, so many Americans are unknowingly overpaying for their prescriptions. Today, we're going to talk about something that's hitting your wallet harder than you realize: prescription drug overpayments. If you've ever picked up a medication and thought, why is this so expensive? This is an episode is for you. So why is this, Alan?
Well, let's start with a little context. Americans are spending over 500 billion a year on prescription drugs. And here's the shocking part. Studies show that up to 25% of people are overpaying for their prescriptions, often without even knowing it. And why? Because the system is designed with confusing prices, middlemen, and a lack of transparency. For an example, did you know you can have the same generic drug that can cost $4 at one pharmacy and $35 at another, even with insurance? That's not frustrating. That's money out of your pocket that you could be saving or investing.
So who's profiting from this, Alan?
When I started looking into these lawsuits and things, I got a new education. Let's see who's behind these crazy price differences. Let's break it down. Pharmacy benefit managers, or PBMs, are middlemen between the drug manufacturers, insurance companies, and pharmacies. They negotiate rebates and discounts, but here's the catch. They usually keep those savings instead of passing them on to you. That's downright wrong as far as I'm concerned. Insurance companies sometimes push you to use preferred pharmacies where the prices aren't necessarily the lowest, and in some cases, using insurance can actually cost more than paying out of pocket. Another one is retail pharmacies don't always have consistent pricing. The $10 medication could be $70 a few blocks away. It's like booking for a plane, a ride on a plane. Would you be the first one without shopping around? Of course not. But we do it with prescriptions all the time. The bottom line, the system profits off your lack of information, but that can end today.
How do we avoid overpaying, Alan?
Number one, ask for the cash price. Sometimes it's lower than what you pay with insurance. Always ask the pharmacist to check both options. Number two, use discount apps like GoodRx, Single Care, or RX Saver. You can search a medication, find the lowest price nearby, and show the coupon at the pharmacy. Simple and free. Number three is a big one. Shop around. Big box stores like Costco or Walmart often have cheaper prices, and you don't even need a membership at Costco to use the pharmacy. Number four, try mail order of subscription pharmacies. Services like Mark Cuban's Cost Plus Drugs sell generics at near wholesale prices. Number five, talk to your doctor about alternatives. This may be a generic, lower dose, or similar medication that can be just as effective and far cheaper. Now, I had a client who was paying $90 a month for a blood pressure medication. We looked it up on GoodRx. The same drug was $14 at a different pharmacy. That's over $900 a year, Neil, saved with a 2-minute search. Knowledge is power, like I say with my financial strategies, especially when it comes to your health and finances.
How does this issue tie into retirement planning and long-term financial health, Alan?
Neil, there's so many things that go into your financial planning, but this is just one of them. Do you realize the last time I checked, people over 65 will spend approximately $315,000 in healthcare in the next 20 to 25 years per year over the total. But one of the things, Neil, you can do this, and this is what really kills me. And this is off script, but I have a preventative health and wellness program. And the employees on this program have 1,100 prescription drugs at zero copay. It does not affect the taxation of Social Security. It does not affect a healthcare plan. It's just a benefit. You don't even have to have a healthcare plan to have this. And what it does for the employers, it lowers their FICA taxes. It saves the FICA taxes for the employers anywhere from $500 to $700 a month. So the employer is going to save this money. These people with these preventative healthcare program have an 8% higher production rate. So he's going to get more income that way at a 7% higher retention rate. But think about that. 1,100 drugs at zero copay. Do you realize, Neil, that that prescription drugs account for 40% of all healthcare costs if you've got a healthcare plan. 40%. And if I can get rid of that with my programs, you got lower healthcare costs and a lower premium and a lower deductible. I've got solutions out there for people if they want to talk about it. I want people to think outside the box, like I always say before. You can get started today and give me a call at 910-551-1046 or email me at strategicwealthstrategies.com. Excuse me, I got that one wrong. strategicwealth, the number 0 @gmail.com. Or they'll always go to my website at www.strategicwealthstrategies.com. And Neil, there's so much stuff out there that people have no idea about, and they take it for granted because it's on the news. I don't take anything for granted anymore on the news, especially what's been going on. Oh, there's so much dishonesty and outright lying on the national news, and people have lost their trust.
All right.
And I just want to get it back.
All right, Alan. Appreciate it, sir.
Yes.
All right. That was the Strategic Wealth Strategy podcast, guys.